Welcome to Food for Thought. This is a webinar series here at Sanford Health where we are elevating topics that are important for diversity, equity, and inclusion. This month, the month of February, is recognized as Black History Month all throughout the United States. Today, I am so privileged to be joined by two members of the Sanford family who have that lived experience and are a valuable member of the Black and African American community. Today, I'm joined by Dr. Stephen Daniels and Michael Burson, who is a senior social worker. I'd like to turn it over to the two of you for a quick introduction for our listeners. Do you guys want to share just a little bit about your background and maybe even your personal journey to Sanford Health? Dr. Daniels, I'll start with you.
Well, thank you. Well, my name is Dr. Stephen Daniels. I am an anesthesiologist and presently service chair for the Department of Anesthesia in Fargo. I interviewed here when it was Fargo Clinic in 1990. November of 1990, I came up to interview. Excuse me. The reason I bring that up was because when I was called about this job, I told the gentleman who was talking to me, I said, "Do you have a picture of me?" And he goes, "No, why?" And I said, "Well, I don't know if you'd be working this hard to get me there." He goes, "Well, it wouldn't hurt to come see us." And I agreed. Well, I arrived and I was at the airport standing there, and obviously he didn't know I was African American. And this is when Northwest Airlines was flying, and I get this overhead page. I've been standing for 15 minutes, and it says, "Dr. Daniels, will you please come to Northwest booth?" And I walked over, and there was this gentleman who had been there for a while. He had no idea who I was, and I said, "I'm Dr. Daniels." He was probably 5'6", and so he turned around and look, I'm 6'4", and he looks up and oh, and then in my head I thought, I don't know how this is going to work, but I'm in Fargo. We'll see how this goes. The reason I bring it up is because the next day, the president of Fargo Clinic, I had an interview with him. He walks in, he sits down, we start talking, and he goes, "I wasn't aware that you were African Americans." It was Dr. Paulson. And Dr. Paulson said, "You know what, I'm going to change things around. I have a friend who teaches, African American teaches over at, which was then Moorhead State, which is now Minnesota State and Moorhead." And he goes, "I'm going to have you have coffee or tea with him, and so that you can ask him what it is like to be in Fargo as an African-American professional." That really settled me. For someone to have that ability to understand that, pardon me, I was like, maybe this will work. And so by the end of my interview, 2 days later, as I was waiting, and I got back to Columbia, Missouri, and everyone was going, "Well, you're not going there, are you?" And I go, "Well, I got to wait. I got to see how this works." So anyway, I ended up accepting a position. I thought, well, I'd be there for 5 years, and I've been here for over 30 years, well, a little over 30 years. I went to medical school at the University of Missouri, and I did my residency there as well. I had the pleasure of being president of my class for 4 years running, and the dean of students, who is now retired, always reminds there's only been 2 of us who's ever done that at the medical school. And one, I happen to know her very well, and I didn't know she had been president for 4 years. I did my residency in the University of Missouri, and I also spent a year, or actually about 8 months, in Milwaukee doing pain management training before I came here. As stated, I arrived here, I knew no one. I didn't know anyone at the time. This community was extremely accepting. And I settled in. I got to know people. People would invite me over. I got to know what Fargo Moorhead was. I got to explain to people why my name was Daniels and not Danielson, because I wasn't Norwegian. But that all being said, it has been a very awesome journey for me. I do not regret at any point in time. I've had the opportunity to raise 2 boys now, and my youngest is now at UND thing. So it's been a very good experience.
That's amazing, Dr. Daniels. We are so fortunate to have you here all of these years. You know, when we think about cultural development, what we know through research is that oftentimes people want to minimize differences because it can make us uncomfortable. And to hear about the ways that leadership, you know, saw you for who you were, instantly had the empathy and the foresight to connect you with people in the community, you know, that could help reassure you. That's just incredible leadership, and I think it speaks to an awesome community. I really appreciate you sharing that story with us. Michael, you are not new to Food for Thought. You were one of the very first guests that we had on this webinar more than a year ago, and it's a pleasure to have you back. Do you want to share just a little bit about your background, your journey to Sanford Health as well?
Yeah, thanks for asking. And I will say, you know, thank you, Dr. Daniels, for sharing your story. That was very encouraging to me to hear you talk about your experience. And it is an honor to talk to the Sanford Health community and the wider family here we have at Sanford Health. So very happy to be doing this. I will just kind of share that my experience was similar, although probably about 30 years after Dr. Daniels. I grew up in the north side of Chicago, a little town called Evanston. And my family was kind of originated on the south side of Chicago. So I spent a lot of time on the south side and the north side with my mom. And it was just kind of feeling like I wanted to do more than the people that were around me. So my mom had always talked about mountains, and you know, and she just kind of did a lot of stuff that people in my family and other Black people I knew didn't do. She liked skiing and hiking and swimming and all the things. And so she encouraged me to kind of explore my dream, and I moved to Colorado to go to the Colorado College for undergrad. And I actually ended up playing sports there. I ran track and played football. I just absolutely loved my time in Colorado. And I loved it so much, I met my wife and we stayed, and I got a master's in social work at the University of Denver, where I worked in a lot of different jobs. As a clinical social worker, I worked at the Children's Hospital in the HIV unit. I've worked in substance use treatment facilities as a clinical supervisor. And then we moved out here in 2018 to be close to my wife's family. They actually live on the Minnesota side. So we live in Moorhead, and that was about 4 or 5 years ago. And so now we're adjusting to things like cold and lots of snow that doesn't go away, but really enjoying our time here, meeting lots of friends, welcoming communities. So now I work at the Roger Maris Cancer Center as a senior social worker, and also started a little bit of a diversity group here that focuses on topics that I hope we cover a little bit today. But it's been a passion of mine, and I've been so honored and really blessed to have the support of my co-workers in this journey. So it's an honor to be talking about this in a public way. Thank you.
Of course. Well, like I said, it's a privilege to have both of you, your lived experiences and the expertise that you bring to Sanford Health as a guest on this webinar. I do want to talk a little bit about Black History Month. It is the reason for the conversation. I want to talk just a little bit about the history of Black History Month and really how you have come to understand it. And I'm open to either one of you kind of weighing in on that.
Well, I would say that it's interesting because as you look at how Black History Month has been celebrated, you always think of, because of the most recent event, Martin Luther King celebration and the things that are associated with this and the expansion of it. But, you know, it's a lot older than that. You know, it looks like they had actually looked at celebrating this because of not Martin Luther King, but because of Frederick Douglass, because his birthday was in February. This was the turn of 20th century. And, you know, it was, so for a little over a year ago, I was surprised at how long we have been looking at this. It just hadn't been on our radar. And then, of all places, coming around 1970, which is when probably you were just born, Michael, if not, but I was just getting ready, you know, in high school. Those times were very turbulent times for me growing up and things. And to understand that even at that point, they were beginning to celebrate Black History Month. And it didn't come on a lot of our radars until a lot later than that. So this has been going on historically for quite a while, you know, and they have different themes and things like that as well. So.
Yeah.
I might add to that, Dr. Daniels. You know, when I think of Black History Month, I think of, you know, one, why do we call people with dark skin Black? You know, and it used to kind of be African American. But I think for me, it's important to acknowledge some of that history, you know, that the Black community has experienced. So I think of Black people who came to America, you know, really in the 17th century to drive the economic engine of the United States as it was, you know, being created. And we, of course, call that slavery. But that really is kind of a historical context. And then since then, you know, we've had Black African American people come over the centuries to America, some willingly and some unwillingly. But, you know, nowadays we think of anyone who has dark skin as Black. And I think that's an important point to acknowledge, because there's a wide kind of spectrum around that category that we all share, and we all have common experiences in today's America, I think. So for me, Black History Month, I think, is a time to reflect on that history, and also a time to celebrate the many achievements of Black people throughout the years, and given the hardships that many Black people have had to go through to get to where they are, that really marks the celebration point for me, and why we celebrate.
And you know, when I was growing up, you know, at that point in time, there was such an argument about African American people of color, but there was a strong feeling they wanted to be called, that they wanted to be associated with Black. I'm Black and I'm proud. As I was growing up, those were the things. Not that I was very active in those, but that was the theme. And when you look back at the Olympics at Mexico at the time, and getting, you know, they wanted to celebrate that clear difference in color between Black or African American and white at that point in time. But I think you bring up a wonderful point about there are a lot of people of color, Black, brown, that all go through very similar things at different points in this country's history.
Yeah, I really appreciate both of you just taking the time to honor the nuance that exists in the space of recognizing Black history, the historical context. But also, Michael, you made the comment about, finding the joy, celebrating the achievements, not just talking about the struggle, but also talking about the progress, the shared lived experiences that we're able to create together today in our communities. With that, I think it's important we talk a little bit about, the importance of these recognized months. We have a wide variety of months that we've done talks on here at Sanford. I think about Hispanic Heritage Month and Native American Heritage Month. Why is that important? Why do you feel like that's important, to the communities that are impacted and those that we lift up?
Well, one of the things I read many years ago was that if a race has no history, it has no worthwhile tradition, which leads to the potential danger of extermination. And written history is more important than spoken history. And if you look at the history, those who had spoken history are very difficult to follow, and we really do not recognize a lot of them. A written history in which a lot of African Americans were brought here from Africa, as mentioned, their history, even though it went further back, it actually, most of them were born by the turn of the century here in America. So establishing that history and that recognition is important. And I think as other a year ago, I had a chance to attend an enterprise meeting, and I brought up, because I feel like the location we are in, that the Native Americans, to me, remind us of a lot of Black Americans in the past as well. They need help, and where do you get that help from? The celebration of their life is important, and I think that as we went through this, and it's just not only people of color, but it's people with different nationalities. The Irish Americans celebrating their month, disability, women, all who've had an opportunity to show their success in this country.
Yeah,
It's gotten to a point now that it's even international. I mean, you got Canada, Great Britain, Ireland, Germany, I think Sweden, all celebrating some form of a people of color month.
Yeah. And I think you brought up a really important point, just around the historical erasure of some of the historical context. There are Black people in America today that don't know that lineage or that heritage, right? And so this is one way that we help create a new tomorrow, for future generations, lifting this really important topic. Michael, I kind of want to turn the conversation over to you to talk just a little bit about some of that equity work at Roger Maris Cancer Center. Some really incredible work has been done to really help providers understand how to work interculturally, the purpose being that we know that health disparities exist in communities of color. Do you want to talk just a little bit about that?
Yeah, I think we've referenced kind of the Black experience in America, and the reason we know we can talk confidently about the Black experience is we've started taking a look at the numbers and the statistics, and we've had the help with the CDC and the National Institute of Health and Health and Human Services. They've all taken a look at all our numbers and said, really what's happening is Black people are having a different experience with their health care. And so some of this for me, I've been learning a lot, and I'm continuing to learn, but some of it has to do with the way the laws were written. I think Dr. Daniels, you referenced a tough time. I think of Jim Crow laws that lasted 100+ years. I think of certainly all the laws associated with slavery and how that affected the people, and those stories were told and continue to be told to Black Americans. And there was lots of issues with trust, missteps by the medical community. So right now, what the numbers tell us is that in regards to healthcare, Black Americans are 3 times as likely as white Americans to develop cardiovascular disease and twice as likely to die from it. Black women in our country right now are diagnosed at higher stages of cancer and have higher mortality rates. And following the wake of the pandemic in 2020, we wanted to take a look at that here at the Roger Maris Cancer Center. We are alarmed by the experience of the Black community in America, and it's important that we take action. So we took a small step, a very small step, but we wanted to create a way to address a barrier to care. And we know that the Institute of Medicine put out a report in 2003 referencing first steps. And so we gathered a team together of leaders here at the Cancer Center, as well as medical professionals. And it was about 20 of us. And we wanted to take a look at our own bias. And we started with all the clinicians and providers here at the Roger Maris Cancer Center. That led to us offering a series of trainings here at the Cancer Center regarding our own bias and the experiences of our patients. And then it led to some national attention, which is really fun to report. We've been looking at collaborative efforts with some outside entities with regards to research and initiatives we can do to improve the experiences for all people, not just Black people, of course, but we also live in a region where there's a lot of Native American population, and they have similar, if not worse, health outcomes. And so, you know, we really wanted to address that within the cancer context.
Yeah, well, I speak for a lot of Sanford when I say we're so proud, of the initiative of, the Roger Maris Cancer Center, and certainly Fargo in general, just to really elevate an important topic. I remember late last year going to a conference where you guys were reporting some of the findings. What did you learn, as you really challenged providers to think about bias and how it impacts that experience and ultimately the healthcare outcomes? What were some of the learnings?
Great question. Yeah, the main thing we learned is we need a lot more of what we're doing. So our providers, I think, communicated to us that they want more training, they want to learn more, they want more exposure, and they also want the time to be able to engage in that good work. I think from our patients, we learned that many of our patients of color or our marginalized patients are telling us they don't feel like they have the, we call it self-efficacy, to negotiate with their doctors. So our patients need to maybe continue to work and engage in cancer treatment. And if their doctor maybe says it's best that you don't work, that could be detrimental, especially to our patients of color who maybe need to continue to work through cancer treatments. So we want our patients to feel like they have the ability to communicate that to our doctors. We were finding our patients were more readily taking our doctor's word for treatment, even though it was causing them harm. And so we wanted our patients to be able to say to their medical team, this treatment is painful for me. Is there something we can do about it? Because we don't want anyone to unnecessarily suffer through their treatments. And so this was an important learning point for us as we tried to build a more equitable cancer center here.
Yeah. Well, I love that you talked about just that self-efficacy and that advocacy piece. You know, I think that underscores the importance of roles like yours. You know, being that social worker, walking hand in hand with patients, all patients. But again, just like you, I think about you know, those marginalized groups that come to us for care. This has been a really important conversation, you guys. I wish that we had lots of time for this discussion. As we round it out, though, and really wrap up the Black History Month discussion, I'm wondering if both of you would be willing to share just a positive reflection. You know, as you think about the representation in the Black community that you have also with the medical community, what's a positive reflection you would share with our listeners? Dr. Daniels, we can start with you.
Well, I've always kind of, when we've talked about the disparity in healthcare, it really comes down to if you have that, when they walk in and they see a provider who looks like them, color-wise, that is, you know, as opposed to being 70 years or mid-60s and white, that they may be a little bit younger and everything. When I'm able to walk in and see a little kid who's a minority kid or a person of color, and their eyes light up, and they are just so excited that, you know, well, wow. And you know, you're talking to them and playing with them and telling them that how you're going to go to sleep and what it's going to be like, and you ask them, are you scared? And they look at you and go, no. And you feel, you know, and you run into kids that say yes, but it makes you feel so comforted that you're able to let them feel like, hey, I have someone here and I trust him, you know, and you know, and the parents, you know, obviously when they see that as well, and you know, it's been a while, but you know, there were times when I'd walk in and someone would say, oh, someone's here to take me to physical therapy or something. I go, no, ma'am, I'm your doctor who's going to be putting you to sleep. Oh, and you know, and then they like to apologize, but you tell them, no, that's fine, we understand, and go through it. But it's when I deal with the little ones and you get that big smile on their face, that's what it always makes me feel good. I love taking care of kids. I love taking care of all my patients, but it's, you know, the children are the ones, you hear that song, they're the ones of our future, and you always want to make sure they come out feeling like, you know, I always tell them, you want to come back and see me? And they go, no, but after the surgery. But up to that point, they're happy about it.
Yeah. You know, the power of representation, you know, I think that's a really great message for everybody. Just the difference that can make, you know, to see someone who looks like you, who has maybe a shared lived experience that, you know, is really important. What about you, Michael?
We have such a community. You know, the Fargo, this region is becoming more diverse as we continue to grow. And the reason it's becoming diverse is because this is a region, Sioux Falls, Fargo, Bemidji, these are where jobs are at. Jobs are not in Chicago, New York. They are here, and you can raise your family here. And so our community is becoming diverse because of the ability for people to come here and have some form of economic success.
Absolutely. And positive reflections from you, Michael?
Yeah, and I appreciate your words, Dr. Daniels. I agree. I think representation is so important. It's extremely important. And, you know, for me personally, Black History Month has been about experience and inspiration. You know, growing up in Chicago, there were some rough spots in terms of the way people thought about themselves. You know, my family members and people I loved and my friends. You know, we didn't think we could achieve at a high level, and there was a lot of reasons why that was. So seeing somebody be successful, you know, seeing somebody kind of break that mold and do something kind of outstanding was very inspiring growing up. You know, you think of like the athletes and Oprah Winfrey's and stuff I was exposed to in Chicago, and, you know, kind of the Michael Jordans of the world. But for me, you know, I've been learning a lot, and I think of, you know, now who were some of those first leaders that broke that mold, that took that step, and getting that really exciting kind of inspired feeling. You know, so I think of Dr. Daniel Williams. In 1856 to 1931, he lived, and he performed the first successful open heart surgery in 1893. What an accomplishment. He also owned he also started the first training school for nurses in a Black-owned hospital in 1891. I think of Dr. William Hinton, who was the first Black American to hold a professorship at Harvard. And then, of course, Dr. Mae Jemison, the first Black female astronaut in NASA's history. So, I mean, these are some of the pillars that have propelled me forward in my career. And it's humble, you know, I'm a humble social worker, but I take pride in the idea that there's not a lot of Black male social workers in this region yet. So I do feel like a little bit of a pioneer in that regard. And I love the idea of going to schools. I've talked at schools and inspiring, you know, other kids to think about their lives and what they want to do, because in the 1970s and 80s in Chicago, there wasn't a lot of encouragement to achieve and to pursue academics. So very excited about the idea that we can do more here.
Yeah, and do more we will. So that's a fantastic way, I think, to depart on the conversation. On behalf of Sanford, I mean, we are just so incredibly fortunate to have both of you within our organization. I feel particularly fortunate, you know, to have been joined by you today for this important conversation around Black History Month. As always, there's more information available out on our Diversity, Equity, and Inclusion SharePoint site, which can be accessed through the front page of Inside Sanford. This conversation and other materials will be posted this month during February. So thank you both for joining me today.